family. So thank you all for coming. I know it's the end of a long day. 6 o'clock to 7:30 isn't the most popular time, but you're all dedicated, so thanks for being here. And I'm really excited to be able to have this opportunity to share some of the work that we've been doing over the last 3.5 years since we were funded to be a Center for Excellence. And we've been amazingly productive. We have wonderful people working here. Having the support of the Mind Institute has been a part of that. And we really are already coming to the point where we have to start thinking about a new 5-year plan. So we really wanted to have community input more than sort of our community of the advisory council, but to open this up for ideas and discussion as we move into sort of another phase after we've had our first 5 years. So let me just kind of walk you through what centers of excellence are, kind of what the network is that we belong to. So really my objectives are just to share the work that we've done so far, to explain what centers of excellence for developmental disabilities are, and then have a forum for talking about some ideas and activities that we may take on in addition to the ones that we've already embarked on. So let me start by, for those of you who don't know what University Centers for Excellence in Developmental Disabilities are, we call them UCEDs. They were initially called University Affiliated Facilities. They were established in 1963 with the Developmental Disabilities Act, and this was part of the Kennedy administration historically, and they were really to provide facilities, money for buildings to do research in mental retardation, and then they evolved into something called UAPs, University Affiliated Programs, which really became more training programs so that there would be professionals trained to work with individuals with developmental disabilities. And then they morphed into UCEDs. So really, we now are one of 67 federally funded and designated centers. And the reason that they've always had the U in front of them is that they were really established to provide links between all the resources that academic institutions can provide to communities, to really be the bridge between ivory towers, research institutions, to the communities in which they are located. And as you'll see, that the communities for UCEDs really are, in some instances, an entire state. So really to be that bridge, to focus on issues, research, information, training, to improve the lives of individuals with developmental disabilities by doing education, research, and service. So if you look at this map, you can see that every state and every territory in the United States has at least one UCED. California is the only one that has 3, actually. Some of the other states have more than one. They tend to be the larger states or the more populated states. But California has 3, so we have that distinction. And the other UCEDs in California are at UCLA, called the Tarjan Center, and at USC at Children's Hospital, Los Angeles. UCLA and USC were one of the originally funded UAFs, UAPs, and then UCED. So they have been part of this network for a very long time, since 1963. And as a director, a new director, having those other 2 UCEDs has been a wonderful experience for me in terms of mentoring, having collaborators, and really being able to feel like maybe we could address some of the issues that affect individuals with developmental disabilities across the state. But we are really it in Northern California, and I think our issues of distance, rural health care, getting training into rural communities where there are not a lot of resources is something that we have really been trying to focus on. In the state, in all the states, there are also state councils on developmental disabilities and Protection and Advocacy, which in California has just changed its name to Disability Rights California. So state councils are funded both by federal money and by state money to, again, work within this partnership with the UCEDs in the state and with Protection and Advocacy to come up with a strategic state plan to address the needs of individuals with developmental disabilities and their families at a statewide level, and also to network at a national level with other state councils, with other protection and advocacy. And all of us as UCEDs also collaborate both within the state and nationally. So all UCEDs share 4 core functions. So this is really what we are given our funding to do. One is to provide education. And it's primarily pre-service interdisciplinary training, although really the UCEDs do training at all levels, post-service, certification levels. And also, next, to provide exemplary community service, which also involves a lot of training or technical assistance, as well as clinical services, program evaluation, and program development. Research, both basic and clinical, and dissemination of that research, really making it understandable, making it applicable, so that it doesn't stay in the university, but it gets into the community. And advocacy, we see as a big part of that. So even though we all have the same 4 mandates, or the same 4 core functions that we have to provide, the UCEDs are all very different, and many people have used this ice cream metaphor, which I'm borrowing, is that we all start out with the same core functions and basically the same kind of ingredients, but UCEDs evolve based on the professional expertise and the resources in their communities, at their universities, should be reflecting the needs of the state, and most importantly, and clearly reflecting the needs of the state, is to have consumers who are providing input, members of the community who understand the needs of individuals with developmental disabilities, and both within the community and sort of as individuals and family members. So we have a wonderful community advisory committee, and this is just a picture of some of that committee, and some of those people you might recognize are in the audience. And I just wanted to thank everybody who's on our CAC, who came tonight and who's also worked very hard. And would you just stand up so everyone can acknowledge you? If you're here, Scott Lorigan's here, Kathy McKitka's here, Robin Fry, and Debbie Sarmento, and Ron Huff. So thank you to all of you for the hard work that you do in providing us with input. Now as we were just beginning our CEDD, we took the U off because it just seemed easier to say. We really developed, we wrote a grant. We didn't have a consumer advisory committee when we wrote the grant. And so we just kind of made our best guess at where we had expertise, what we thought were important needs in the community, knowing that we were going to have to change, grow, develop our objectives and our goals once we had selected our CAC. And so we started having lots of ideas, and we were all sort of swarming around. We had very few staff that we had hired at the time to help make this happen. And so Gina Guarneri, who is one of our staff members and absolutely incredible, came up with, when we had a retreat, she said, if you don't mind, I think it'll help us to sort of talk about what are we doing, where do we want to go, and where are we focused, main areas? Can I just bring a visual? So she brought a tree. And this is a sample of our tree. You might guess that she does preschool. And I think it reflects her early intervention experience. But we've actually gotten fancier. And so this tree, thanks to the technological expertise of Sierra Prine, who I don't know if he's here, Paige Mayer, who is here, wave your hand, and Ruth LeBlanc, who isn't here. This was not my doing, and anyway, I just want to thank them for having such a fancy tree, because this, I think, has really become our touchstone. It's become sort of our family tree, and I think it reflects our values, it reflects our mission, and it reflects the projects that we're doing, the growth that we've undergone, and kind of the things that are our basis and what nurtures us. So I forgot a pointer. Well, let me see if I can. So I love this analogy because if you look down here in terms of what's in the soil and what really helps us to be nurtured, our funding source is the Administration on Developmental Disabilities at the national level. They certainly provide us with nurturance. The DD Act itself established the Centers for Excellence, so we're definitely nurtured by that. Our executive committee helps us with resource allocation and planning. Our staff do all the work. They are amazing what they do. And I'm going to introduce them and probably embarrass them, but Lori Llewellyn is our co-director for administration. She's right up here. Paige is in charge of our website and many other things. Gina Guarneri is responsible for our early intervention activities and assistive technology. Who else is here? We have other faculty. So as we go, I will make sure that if I have missed anybody, I'll have you stand up. Oh, actually, I consider Dan we've borrowed part of Dan because he is a MIND employee, but he has done so much for us in terms of our technology and videos that you'll see that I'm going to show off for you. But our Consumer Advisory Committee really is, for us right here, and in terms of how we're developing our UCEDD, probably the most important input that we have and really truly our most nurturing component. Together as a CAC, we wanted to establish and needed to establish what are our values? What are the values that guide us in all that we do that we need to keep coming back to? And so we put those as the roots of our tree. So you can see that our values are that anything we do needs to be family-centered. It needs to address disparities in services. It needs to provide empowerment. We need to think about being synergistic and not duplicating services or competing. We need to establish partnerships. We need to be inclusive in everything we do, person-centered, focusing on self-determination, hope, access, compassion, diversity, and quality. So as a group, these are the values that we try and live by. And then in the trunk of the tree, that's why this slide is dark brown, the mission, thank you, David. Okay. So the mission, I just wanted to read it because I think we worked very hard on this. We played around with the words. We wanted it to really reflect our values, but also be something that we could remember and that was very clear. So our mission is to collaborate with individuals with developmental disabilities and their families to improve quality of life and community inclusion. The center accomplishes this mission through advocacy, community partnerships, interdisciplinary training, and the translation of research into practical applications. So it's quite clear, I think, and we again try and keep coming back to that as we are growing this family tree of ours. So what I wanted to do to give you a sense of what are all the activities that we have started, some of which we've finished already in terms of our original 5-year plan, and where we'd like to expand, is to take each of these branches and give you a few examples of some of the activities that we're working on. So let me start with the interdisciplinary pre-service training. And the leaves that are green are activities that we are continuing to work on. The leaves that are yellow are projects that we've already finished, so it's very visual and sort of literal. So in terms of interdisciplinary training, we have a training program for developmental pediatric fellows, which is a very intensive 3-year fellowship that is accredited and enrolls pediatricians who finished all of their general pediatric training for 3 more years of intensive work, clinical work, and research in developmental and behavioral pediatrics. We've also, since we've had the CEDD, been able to expand our training because we have partnerships with CSU Sacramento, with CSU Chico, as well as the School of Education at UC Davis and faculty at the MIND Institute and the ARTP training program. We've been able to expand our trainees to include some of the nursing students from Sac State, education, graduate students, psychology, and we're hoping to expand to occupational therapy, speech and language, audiology, and social work as well. So that's our goal. We have an interdisciplinary seminar that is meeting 4 to 5 times a year. It's very interdisciplinary. We also have law students who are starting to come from McGeorge. So we're really excited about this, but it's definitely an area where we're doing a lot of expansion and are excited for collaborators who are interested. All of our trainees, as part of this interdisciplinary seminar and as part of their training at the CEDD, will get training in all 4 of the areas of emphasis for the UCEDD. We also have supported a special studies program in autism spectrum disorders, which is offered through the UC Davis extension, that we have tried to help support and expand in terms of moving it towards a credential in autism studies. It's right now a certification in autism studies that is a 3-quarter content course that we're helping to support to get all 3 of those quarters online for people who would like to take it from a distance so they don't have to travel to UC Davis to take it, and then to help add on the skill-based training and the credential. So that's something that we're working on and is an area in our training program. So moving on to the branch that reflects our activities in community outreach and advocacy, you can see that we have a lot of leaves on this branch, and we would like to have a lot more leaves on this branch. That's partly why we're here tonight, to ask you for input. And what I wanted to mention at this point, since I forgot to do it sooner, is we have on each of your seats, or hopefully you got it when you came in, a form that if you want to either take notes or make comments to remind yourself of areas that you would like us to think about expanding into, please use this piece of paper. We tried to organize it around interdisciplinary training, community service, information dissemination, advocacy, and research. So if anybody doesn't have one of these for feedback, please, Gina's passing them out, just raise your hand. That way, if you have ideas as I'm talking about some of these activities, that you either have questions, you can write it down and not have to remember till the very end. So you can see we have many of these activities are fairly well established, and some of them are just beginning to really blossom. And one of these is our youth and young adult advocacy. We have worked with both the Tarjan Center at UCLA, the California Health Incentives Improvement Project, and the California Foundation for Independent Living Centers to help expand some of their services, like the Youth Leadership Forum for adolescents and young adults with developmental disabilities to take on leadership roles, get training in advocacy, and that's something that we're really excited about. The other program that we're really excited to collaborate with the Tarjan Center is to be providing help and support for families and individuals with developmental disabilities to think about post-secondary education, to think about college as a possibility, and to help for those individuals who are choosing to go into college or other training opportunities after high school to develop sort of an orientation program and a support system at the UCs and in the community colleges and the CSUs across the state. So this is an area that nationally has gotten a lot of notice. There's a lot of development, and in California, we are really ramping up, and it's very exciting, I think, to think about all the possibilities that we hope to make available. We've also been involved at a statewide level in trying to improve access to services and to evidence-based practices for individuals with ASD. We have played a significant role in being the primary facilitators for the Interagency Autism Planning Group, which represents service providers, individuals, family members, agencies in education, developmental DDS, and health, to come together to try and coordinate services at a time when, with the economy shrinking, having duplicated services makes no sense, and really trying to work together to use all of our resources as best we can. What came out of that IAPG was a grant application to the National Professional Development Center for Autism for a state training, which we were granted. We were chosen to be trained as a state. We have developed our training plan. We will be starting our training this summer. We have an intensive summer institute, and then the following year a trainer of trainers. So it's a ripple effect. So we hope that through by receiving this training at a statewide level, we will be raising the level of training and expertise in providing evidence-based services to children in the public school systems at all levels. So we're very excited about that, and I think it came about because of our CEDD. The other educational activity that we have taken on as a CEDD is to really take over the planning for the Summer Institute, which is an annual event that the Mine Institute has sponsored since it started. And I know that many of you have come to the Summer Institute in the past. I just wanted to remind you when our dates are. We have the main Summer Institute August 6th, which is a Friday at CSU, and then on either side of that we have several workshops planned. One of them is the Early Start Denver model training, and also we will have a workshop on Tourette's syndrome, and we are still working on having some other workshops. So those will be really skill-based workshops, and the Summer Institute is both translational research as well as some skill-based. So we're very excited about that, and actually, Dr. Amaral is going to be our keynote speaker. The other project that I just wanted to highlight in this area is a grant that we're working on from the State Council on Developmental Disabilities, and I think this is definitely something that came out of our CAC from family members to develop parent training modules that are available online whenever you would like to access them, as well as through DVDs. That these are training models that have been taken from a face-to-face training workshop and have been developed into online and DVD modules. These are focused on family members and care providers of children on the autism spectrum, and really focused on teaching adaptive skills and managing difficult behaviors. So this grant is going to allow us to not only develop them in English, but to also translate them and have them available in Spanish as well. So again, this addresses some of the issues around not having a lot of resources in some of our rural communities. This will be a resource that's available. If you don't have internet access, if you at least have a computer, could go to someplace that has a computer. We'll be disseminating DVDs as well. And the website. So we have a wonderful website committee that has, from day one, become very excited about developing this resource as a resource for families and individuals with developmental disabilities. And I'm hoping that I can show you and walk you through a little bit some of the resources that are on there right now. But really, the focus from the CAC and the task that the website committee has taken on is that we were developing the go-to website. So for a community of practice, for online videos, blogging, news, translational research, and feedback, a mechanism for feedback. What would you like to see on this website? And if I can get to it, I will just sort of walk you through and show you some of the examples of what's available there. So this is the website. And you can see there's our CAC, part of our CAC. The pictures rotate, so there's our resource center here at the Mine Institute. And then we have a picture of consumers. So we have, who we are. There's our mission, who's part of our team, who are our partners, how do you get in touch with us, what do we do? Again, these are the branches of the tree. And I just wanted to show you some of the resources that are both in English and Spanish. And specifically, I wanted to show you a videotape that was developed for both healthcare professionals as well as parents that came out of our translational research in 22q 11.2 deletion syndrome. So this was part of Tony Simon's cognitive neuroscience research, and Tony has always been concerned that he, as a non-clinician, would like to be able to have better explanations of his research so that families can take them home and use the information that they have learned about their child participating in our research projects, take them home to their communities, because they fly from all over the country and all over the world to be part of this research. And so as a team, we provided with CEDD support money to translate that information, to say this is what the research on your child, the testing that was done on your child, this is what we think it means. This is how we think resources would be important. We try and help find those resources that might be available in their community, specifically around the recommendations. And then we felt that it's hard for parents to take all this information back to their communities, sometimes to primary care providers who've never had another child with 22q 11.2 deletion syndrome, educators, intervention therapists who have never seen a child with this, and it's a lot of information to remember. So what we thought we would do is develop some videos or DVDs for families to take home. And so what has been developed, and I think Kathy Angustiri's here, and we think she should have a career in, I don't know, videotaping or news anchor, right. So I'm just going to show you, so this was what we developed, what actually Kathy developed for primary care physicians. It talks about what is 22q 11.2 deletion syndrome, what are the common medical components, what's important as a pediatrician that you know about it, so that you know you have to do blood tests every year. You know you have to check X and Y. So I'm just going to show you a little tiny snippet of this, maybe. This is all Dan's wonderful work.
Chromosome 22q11.2 deletion syndrome, or 22q11.2DS, is the most common genetic microdeletion in humans. The estimated prevalence is 1 in 4,000 live births, though you may not have heard much about it before. This is because 22q11.2DS can manifest in many different ways. It's been associated with symptoms like structural heart disease, cleft lip and/or palate, immune system difficulties, mild facial feature differences, learning differences, as well as a myriad of other medical and neurological problems. It's not surprising that because the features of this syndrome vary so widely, 22q11.2DS is often underdiagnosed or completely unrecognized. Part of the confusion is many different names used in the past: DeGeorge syndrome, velocardial-facial syndrome, conotruncal anomaly face syndrome, and many others. However, once the underlying genetics of these different syndromes were found to be the same, many professionals agreed on the chromosome 22q11.2 deletion syndrome label. Humans have 23 pairs of chromosomes shown here on this karyotype. Each chromosome has a short arm, labeled P, and a long arm, labeled Q. Why P and Q? P stands for petite, the French word for small, and Q is simply the next letter in the alphabet.
So that's something you probably didn't know. So again, it goes on. It's very accessible to primary care physicians. It's so well done. It's really very wonderful. And it's also important, I think, the family members appreciate having this kind of information too, as a reminder that, you know, I really need to remind my pediatrician that it's time to get our blood test. The other thing that Kathy did was interview families who have children with 22q11.2 deletion syndrome. She did a wonderful job, and I think that the parents talk about the difficulties with the diagnosis, the difficulty having a physician who doesn't understand what their child's needs are, difficulty trying to get services. So I'm not going to show you all these videos, but I think it just gives you a flavor of what's available and what we're trying to develop, more and more of these similar kinds of things. Okay. So what I encourage you to do is, now that you've seen how great this website is, please go visit. There's also a little survey button on the right-hand side so that you can provide feedback if you think there's something missing or something that we should be adding or something that isn't very accessible. Please give us feedback for that because it's continually changing. So you can see that the colors of these leaves are autumn leaves, meaning that we've actually finished this activity. So these videotapes are done. The next part of the project that we're doing around 22q is that we are using our technology, distance consultation technology, to provide ongoing consultation after families have shared this information with their educators, with their interventionists, with their primary care physician, to then provide consultation after they've tried to implement some of these things. And so we're asking the families who are interested to develop sort of teams and set up a video conferencing with, if they can get their primary care provider there or their educators there, and then we'll be available to answer questions that they have to try and help them problem solve around what other resources might be available. So that's going to be sort of our next activity here, to see how we can continue to support families over distance from far communities. All right, so the next branch here is looking at our early intervention, early identification activities on this branch. We have several different activities that I wanted to just mention, and one of them is an activity that we completed, although some of the activities that came out of it are still ongoing, and this was, we applied to host the Region 9 ACT Early Learn the Signs Summit, which is a public and professional information dissemination around how to disseminate materials developed by the CDC that are early warning signs of autism and other developmental delays. So we hosted a summit that included several states and several territories in the Pacific for each to develop a state plan. So we had representatives across California from different agencies, and we developed a plan to try and improve systematic screening and early identification of children on the autism spectrum or children who had other kinds of developmental delays, so that we are reaching out to physicians, we're doing physician training, and we're collaborating with the California screening initiative that's hosted out of the Department of Public Health. So that was a very successful activity that we had, and I think there's work that now is going on that's much more collaborative than before that. Another activity that we've been working on is that both CEDD faculty and staff have been working with the Triumph Early Education Center, which is part of the St. Hope Foundation, to provide a preschool that is inclusive of children and in the graduate group of community and human development who actually are doing their research. It's just a couple of blocks away on Martin Luther King Boulevard, and I don't know if Kristen's here, who's the director, but she has done a wonderful job of developing a very high quality curriculum that's very supportive of children who come from high risk families and backgrounds. Okay, let me just, there were a couple of other things I wanted to talk about on, the other thing I forgot to show you on the website is we've also set up a community of practice for early interventionist home visitors so that they have an online community of practice, sort of exchange ideas, ask for help, pose questions, and get feedback that we're doing in conjunction with IDA and the Infant Development Association and, Gina, help me with? Sac State, yes. Okay, let me move on to the assistive technology branch. We have an AT consortium that includes state representatives from state rehab, Department of Rehab, Department of Education, the Warm Line Family Empowerment Centers, and also the Supported Life CTEC, which has been something that we helped support and fund through CEDD funding. And this really is the Communication Technology Education Center, which provided a forum for families, again, to come look at assistive technology that helps with augmentative communication, try out devices, have professionals who have expertise in assistive technology to look at what's the latest or what's the simplest things that they can do to help improve communication for their family members or for themselves. So I've just listed the website here. We tried to get on and for some reason I think the website's down, but they actually have open houses and wonderful opportunities for both training and for families to just come in and get sort of informal supervision or informal help around ideas that they might bring back to their therapist. We also have completed an assistive technology video that Laura Grease-Hess and Carrie Lemons-Chitwood completed, and it's also available on our website. It's kind of goes from A to Z, from very simple assistive technology to very complicated assistive technology and how it can help with inclusion and be included in regular classrooms. Okay, in terms of clinical services and the issues of reducing health disparities, our faculty and staff are involved in lots of the clinics that were previously established at the Mind Institute, and we've tried to provide with some of our funding some additional components to those clinics and to support the ADHD clinic, support the learning disorders clinic, and to provide, as I said, the supplemental services translational component to some of our research projects. This is what we just sort of talked about. And then I also wanted to highlight kind of an outreach activity that we've taken on to try and look at barriers to services around access and utilization of services for individuals with developmental disabilities who are part of the Southeast Asian communities in our area. And Diane Baker and Liz Miller, who are part of our CEDD faculty, and several of our interdisciplinary trainees have participated in some formative community-based research trying to bring together community members and leaders to figure out what are the barriers to families in the Southeast Asian communities to accessing these services, to knowing about these services. How can we help address some of the obstacles from their own cultural point of view, make it difficult for them to participate in some of these activities. So we've done the initial group meetings, and now we're working with community members to address further issues of getting information that's accessible out to them, and how might we do that? Do we need to do it in terms of face-to-face? Can we get written information? And also maybe other ways of providing that information, so maybe online access as well. Okay, the research and dissemination. Again, we have many leaves on this branch. And again, many of these research projects started way before the CEDD was part of this Mind Institute, but many of our faculty participate in these research projects and also have expanded some of the dissemination components to it and supported some of the family community-based components of it. We have, I can just go through a couple of these. The Fragile X Research and Treatment Center clearly has lots of national exposure, lots of research that's going on that's very well disseminated and translated. I'm not going to go through all of these just because it'll sort of take me too long, but CABLE is a 22q 11.2 deletion syndrome. We've talked about that. PAIRS is a project of Sally Rogers that is doing distance training and using video modeling and telecommunication to do training for early intervention for children with autism. We have several other assistive technology research projects, and one of them that Peter Mundy's working on is a virtual reality project, which is really trying to use virtual reality to help individuals with autism spectrum disorders learn social interactions in a safe virtual space. So we're really excited about that. And then Charge and Marbles are projects that have been ongoing that many of the CEDD faculty are participating in, as well as dissemination. Okay, so we're getting towards the end here. The last part that I wanted to highlight is the collaboration with the DD network and some of the strategic planning that's gone on at a statewide level with the 2 other UCEDs, with the State Council, and with Protection and Advocacy, or Disability Rights California. So we meet every month, either by phone or in person, to work on our strategic plan so that we have goals that address the needs of the state. We are all involved in a legislative advocacy day, and we actually had Disability Rights California come to our CAC meeting to help us learn about doing better advocacy and working with the legislators to address issues that are important for our communities. These are the partners, and I think I've already talked about that. So we hope that this is the forum for helping us to think about other areas that we might want to get involved in, to expand some of the activities that we already have on the branches that are part of our family tree. Before I get to the whole tree again, I just wanted to remind you a couple of upcoming events that we've been involved in that I wanted to make sure that you knew about. Joaquin Fuentes is a child psychiatrist from Spain, and he is going to be here in February. On Friday, he'll be presenting on his work in autism in Spain in the morning here in this room. But on Saturday, we've been organizing a community program that he will be doing for the Hispanic community, and he'll be doing his presentation in Spanish. So if any of you speak Spanish and you'd like to come on Saturday, come to that as well. And then our Distinguished Lecture Series next week, our next speaker is Marcia Seltzer from the Waisman Center, which is a UCED in Wisconsin. And then just a reminder, save the dates for the Summer Institute. So I kind of run through our family tree and how we've grown, the kinds of things that we've developed in 3.5 years. We are in the process of looking at where do we want to go from here in terms of what might we add to our 5-year plan. And so we're looking forward to your input and any ideas you might have, either in writing if you want to put them on the sheet of paper that we passed out, or I'm just going to open it up for comments, suggestions, or discussion. Thank you. We have note takers here, so we'll entertain any suggestions or comments.
That was great, Robin. Have you been working with the National Autism Center? They just came out with a National Standards Project.
Well, some of our CAC members were on the National Standards Project, so we've talked about it. We have, it's really interesting because we will soon have 3 evidence-based practice standards. One is the National Standards Project. One actually also is the National Professional Development Center for Autism, which is the training that we will, as a state, be receiving. They have, there's overlap in all of these evidence-based practices, and I think there are a few differences between the three, and then the long-awaited state DDS best practices guidelines is about to come out. So soon we'll have, in many ways what we've all been hoping for are three, from going from none now to three, I think very well researched and very credible reports that we can pull together to really help families and educators and administrators try and really use their resources to provide the best practices that we know have evidence base to support their utilization. So I don't know, that was kind of a long-winded answer to your question, Linda, but yes.
Thanks.
Yes, I'm working also in Kaiser Developmental Pediatrics, and we've used a lot of your CME activities, and I really like the videos that you had on the websites, as well as I hope to see those DVDs that help in Spanish and English, teach adaptive skills and behavior. That could really be helpful for us. We've worked closely with regional centers and local public schools, but not so much other than referring patients for research and to your research group and from CME. Do you see other ways that large community pediatric groups like Kaiser could work together in this set? I guess that's how you pronounce it. I don't know particularly, so I'm just putting it out there.
Well, one of the things that we have talked about actually is doing some cross-training, maintaining reliability on autism assessments together. Those are some ideas that we've talked about. I think the other piece of it is that in working with some of your Kaiser colleagues around databases and the kinds of information that is accessible if you're part of Kaiser, how can we use that to do collaborative research? I think it's just tremendously rich and a wonderful opportunity to do that.
I'm an occupational therapist, and I wondered how you're planning to engage with occupational therapy in what area of California?
Well, because there's not a training site in Sacramento, it's hard for us to try and figure out how we would include occupational therapy trainees in our interdisciplinary training program. So we've sort of tried to think about, well, once we get established with our local students and faculty, then we can tackle trying to figure out how to do it through a distance. So we've begun to do some work with Chico to think about how could we do that, have students, share students at a distance. So I think once we sort of become well established in that curriculum, then it will provide us the opportunity to try and reach out to other institutions, other universities outside of our local community right here.
Hi, thank you. I'm a parent of a child who's 6 years old and has a sensory processing or sensory integration disorder label. And so what I find is that a lot of the resources available for the autistic spectrum are applicable to my son, but they're not available to us because our label is different. And we're considering a trip to Denver for the STAR Center. I'm wondering, with you being in our backyard here, I live very close by, what do you offer for my family? Or should I just go to Denver?
Well, I'm just looking for our occupational therapist who was here, but I think, Joe is still here. So we have an occupational therapist at the Mind. You are struggling with a problem that many people struggle with. Is if you don't have the right label, it's hard to get access to services, particularly through your health insurance or other resources. So we could talk afterwards in terms of trying to get a referral, how you might try and get a referral here in terms of treatment.
Hi, I'm a counselor here, and I'm also a good friend of Michael and Carrie Gordon. They said hello.
Oh, great.
But
Part of the community.
A summer institute, and we are seeing more and more students on the autism spectrum at the community college. I just got to thinking I would love a partnership with some of your site people.
Yeah.
I think that would be great.
Well, actually, sorry, Dan. We are. We may have. You know, if you might be interested in being part of our team, we are going to a conference in LA in March to look at. It's a conference on post-secondary education for individuals with intellectual disabilities and autism spectrum disorder. So we're getting our team together, and if you would like to be part of that team, come talk to us.
Oh, I will.
Okay?
Good.
Yeah.
We should
Lauren?
everybody to leave name and contact information. The person from Kaiser.
Oh yes. Even if you haven't filled anything out in terms of questions or suggestions on your form, just put your name and your contact information so that we can get a hold of you. Thank you, Lori.
I'm a school psychologist in training, and I've heard that there's a lot of resources available right now for students on the spectrum in the community college system. However, I hadn't heard that there had been much available at the CSU or the UC level, and I was wondering how well that is developing, and also which institutes are most interested in this kind of project.
So on a statewide level and on a national level, most of the work has started at the community college level, but those successful projects are being replicated at four-year universities, and we have a very, very pilot project at UC Davis, and we have interest in, so what we're trying to do is sort of take the experience from the community colleges at a statewide level and think about where are resources in the four-year colleges at a time when nobody feels like there's very many resources. But can we develop some programmatic materials that are replicatable so that we're working on an orientation program that would be directed for both parents and kids before they get there, and then when they get there to have information that's accessible. So if this happens, this is a resource. If this happens, this is the resource. And who do you need to check in with? So that's what we're working on. So we're in the early stages of that, and if you would like to be a part of that, we'd love to have you join our team for that.
So are you looking at starting as a freshman then?
Yeah.
Okay. Thanks.
Right. You're welcome. All right, well, thank you all for being part of this, and if you have any other ideas or comments or hopes that you want to put on your piece of paper and leave it, just let us know, and if you don't want to put your contact information, still give us your information, your ideas. Thank you very much.
The UC Davis Mind Institute began in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, learning disabilities, and other brain disorders is helping children achieve their fullest potential. Please call or visit our website to find out more about current studies, our research team, and upcoming events.